So we would very much like to have a clinical trial where we would establish the cell bridge, give sustained growth factor support, and then add the growth inhibitor blockers. And so we've now proposed these clinical trials, and we've started a couple of them now. The first clinical trial that we've done is a 1-year study of 600 patients with acute and chronic spinal cord injury. And this is to show that our centers can actually collect 600 patients and examine them for 1 year, 6 weeks, 6 months, and 1 year. And we want to show that these are the patients that will come back over and over and over again. And this trial has recently been completed. By the way, these are the same patients that we will now randomize into further clinical trials. These are patients with a proven record of coming back, and we will have solid neurological data on them before their trial. The second one is an open-label study to ascertain safety and feasibility of oral lithium in 20 patients. We just finished that in Hong Kong, and it turns out that there were no significant adverse events. We're now this one is the study that I had suggested to Kunming to take 30 patients and do surgery to expose the spinal cords, because there's a lot of questions about what is the risk of actually exposing the spinal cord, and they have now carried this out in subacute spinal cord injury, and we're in the process of trying to get this published. We've just started this trial, and we're taking phase 2 lithium trial. There's a double-blind randomized phase 2 trial to assess the efficacy of oral lithium in 40 patients with chronic spinal cord injury. This is being done at the China Rehabilitation Research Center. And then finally, we're in the process of applying to the Chinese government for this study, which is to transplant blood mononuclear cells. And this is a dose response curve. We've now gone through in detail a consensus conference as to how best to inject the cells. We've decided that the best way to inject the cells is at a 45-degree angle into the dorsal root entry zone, above and below the injury site, so we avoid all the white matter tracts. And we are starting out with a 4 microliter injection, and then 8 microliters, and then 16 microliter injection. And these are all with about 100,000 cells per microliter. And then once we have gone through this, 4 patients in each group, this is an accelerated dosing trial paradigm, then we're going to do the 16 microliters injection plus the methylprednisolone. We have now shown that when we give a single bolus dose of methylprednisolone, we increase the survival of cells by nearly 4-fold after an injection. And then after that, if we show that that is safe, we go to the final step, and that is the cell transplantation plus methylprednisolone plus lithium. Okay. And then finally, all this is to aim at a phase 3 trial where we're going to take 400 patients and transplant them with mononuclear cells and then randomize them to lithium or no lithium. Now, people have asked me, why are you planning it this way? Well, I know in China, I don't think I can convince anybody to do a sham surgery control. Nobody will agree to that. So we're doing essentially a trial where we're transplanting cells into 400 patients and randomizing them to lithium. And so what are the possible outcomes? One of the outcomes is that none of the treatments show any benefit compared to pre-treatment. In that case, that's a very strong negative. We would not recommend this therapy for anybody. A negative result is very strong. If we find that the lithium plus cell transplant is better than cell transplant alone, then we can actually propose the use of the cell transplant plus lithium, because that's a randomized trial. If we find that both cell transplants and cell transplant plus lithium is better than pre-injury or pre-treatment, then we cannot rule out the possibility that it might be from surgery. So then at that point, we would need to carry out another clinical trial to determine that the injection would be, that the cells are different. Now, I figured that if we do get that result, and that is both umbilical cord blood cell transplants and umbilical cord blood cell transplants plus lithium are both effective, or both seem to be equally effective, the next trial we would do is we would take another cell type and compare it against umbilical cord blood. Then we would gain some information. We are under severe constraints, I think, in China, and I think this will be true in the US as well, that it will be very difficult to design any placebo response. I mean, placebo group. It will be very hard. Okay. So the hypotheses should be quite clear. You know, CN100 is to determine whether or not the patients can get, the centers can get 1-year follow-up data. 101 is to show that oral lithium is safe. 102 is to show that whether lithium has any effect on neurological recovery. 102B is to determine whether it's safe to transplant cells to the spinal cord, and 103 is to see whether the combination therapy is effective. So, finally, is the cure in China? I think the answer is, of course, no. It's not in China yet. However, they're far ahead of the US in several respects. Number one, the doctors there are much more experienced with cell transplantation than any other country. I think in the US there will be a tremendous hurdle in convincing doctors to expose the spinal cord and transplant into the spinal cord. We already saw this in the Cetherin trial. In the Cetherin trial, even though all the animal data had been actually giving the Cetherin directly into the spinal cord, they chickened out at the last moment and they just put the Cetherin outside of the spinal cord. They put it into a fibrin plate and plastered it on top of the dura. You know, there's only one reason for that kind of decision, and that is they were afraid to open up the spinal cord and open up the dura. I think the same kind of fear will be prevalent in the US. There will be a tremendous amount of arguments about, well, should we open it up, and so on and forth. By the way, we've now had extensive discussions with our group, and the Chinese doctors are so comfortable with transplanting cells into the spinal cord. They consider this to be relatively trivial. And when I said to them, would you rather do a laminectomy, expose the spinal cord, inject the cells under direct visual control, or do you prefer to use CT guidance? Almost everyone said we prefer to do it under direct visual control, because CT guidance, there's a risk that the needle might go right through a vein or some surface vein, blood vessels, and cause a bleed. And so there's a huge difference in experience level, and I think the first clinical trial that would do transplantation into the spinal cord will have a lot of difficulties. Now, there was 2 trials already carried out in the US that has transplanted cells. One is the one in Gainesville, where they put in spinal cord into the cyst, but that was with the excuse of actually operating on the syringomyelic cyst. But the one trial where they did transplant the cells is the porcine fetal neural stem cell treatment that was at University of Washington and St. Louis and Albany.